Your joints and your brain need the same 5 things. Here's something surprising about the link between your knees and your brain. The exact same 5 habits that keep your knees from wearing out are the ones that keep your brain from wearing out. But here's the part that surprised even me after 40 years in neurology and neuroscience. Knee pain that goes untreated does not stay in the knee. It can quietly trigger the start of accelerated brain aging. Pain leads you to slow down, and inactivity speeds up cognitive decline faster than almost anything else. That chain reaction from a sore knee to a fading brain is what this video is all about. And I'm going to show you exactly how to stop and reverse this process to both become more mobile and regain your brain vitality. Why your knee and your brain care about the same things? Because they share the same enemy: chronic low-grade inflammation. In your joints, that inflammation breaks down cartilage. In your brain, the same inflammatory process contributes to significant atrophy and cognitive decline. Different tissue, same fire. This means the habits that put out the inflammatory fire will protect both your knees and your brain. Let me walk you through the 5 pillars that are essential for your knees and your brain, whether your joints are perfectly healthy or already hurting. Pillar 1, exercise. Movement nourishes your cartilage and increases blood flow to your brain. Target for 3,000 to 7,000 steps a day. That's just walking, not a serious workout. If you do have time, add 3 hours of vigorous exercise per week. Pillar 2, eat fatty fish like salmon or sardines twice a week. Eat fruits, such as a cup of blueberries, as snacks. Avoid junk food at all times. Cook at home as much as possible and use extra virgin olive oil instead of other oils. Take an anti-inflammatory supplement such as omega-3 fatty acids that contain DHA and EPA at a dose of 1,000 mg per day. Curcumin is also a great anti-inflammatory supplement you can try. These kinds of food choices and supplements calm inflammation in your joints and in your brain at the same time. Pillar 3, sleep. Sleep 7 to 8 hours and pay attention to when you go to bed, not just how long you sleep. Late, irregular sleep raises joint inflammation and disrupts your brain's overnight cleaning up process. Pillar 4, weight and metabolic health. Even a modest weight loss meaningfully reduces the inflammatory load both on your joints and in your brain. You do not need to lose a lot to feel a real difference. 5 to 10 pounds is plenty. Pillar 5, stress reduction. A daily 5 to 10 minute practice of meditation or slow, deliberate breathing lowers the same inflammatory markers that damage cartilage and neurons alike. 5 daily habits, 2 organs protected at the same time. Now, I want to speak directly to anyone watching who has untreated knee osteoarthritis, because this is the moment that decides everything. When your knee hurts, every instinct tells you to protect it by moving less. I understand that instinct, but moving less is exactly how you fall into a trap of accelerated cognitive decline. A slow, sedentary lifestyle leads to brain atrophy and rapid decline in thinking and memory. I have watched this happen to patients again and again, and I have also watched it reverse. I remember a patient of mine who had both knee pain and concerns about her memory. Janet, a retired teacher, was 69 when she came to see me, worried about developing Alzheimer's disease. During our conversation, she mentioned in passing that she also had significant pain in her left knee. As a result, she had stopped going to her pickleball games. She also had quietly withdrawn from her other activities, such as dancing, which she used to love to do. I referred her to a physical therapist, and he put her on a knee strengthening and stabilization program. She did it religiously every day for 3 months. And the woman who came back to see me was not just walking better. Janet was animated again and felt sharper. Most of her subjective impression of cognitive decline was due to her sedentary life and social isolation. Treating her knee pain, in a very real sense, treated her brain concerns. Another one of my patients, Jack, was a 75-year-old accountant. He came to see me for his concern of losing his marbles. Again, I talked to him about his overall health, and I learned that he had lived with severe knee arthritis for years. Slowly, he had pulled back from his friends, his hobbies such as golf, and the life he used to have was very sedentary and isolated. His sedentary life had led to gaining 30 pounds. His mood had darkened and his memory was slipping. He had tried physical therapy exercises, but his knee pain had persisted. His knee MRI showed advanced arthritis, and his surgeon recommended a knee replacement. But Jack refused. He wanted nothing to do with surgery. So we talked, not about his knee, but about his brain, about how movement protects against cognitive decline and how staying sedentary was quietly raising his risk of Alzheimer's disease. That conversation changed his mind. He agreed to do the surgery. 3 months later, Jack was walking 2 or 3 miles a day. He was happier, he was sharper, and he told me with real excitement in his voice that he felt that he was starting an entire new chapter in his life. I share these 2 stories because they're not the exceptions. They are what happens when you refuse to let joint pain shrink your life. Treat your pain aggressively. Set a goal to stay strong and active, not just to manage pain quietly in the background. You should not let anything stand between you and maintaining an active lifestyle. Protecting your knees is not separate from protecting your brain. They both need the same 5 things: exercise, regular anti-inflammatory foods such as a Mediterranean diet, adequate sleep, a healthy weight, and a calm mind. And if your knees are already hurting, do not let that pain become the quiet beginning of accelerated brain aging. Strengthen them, treat them seriously, and stay in the life that you have created for yourself. Make sure that you can move your joints freely and remain active at all times. This is essential for your brain health. I would like to know what you think about this video. Please leave your comments below and make sure to like and subscribe. Thank you. If you have any questions or if you want to leave me some comments, please write them below. Also, please don't forget to like and subscribe. Thank you.